I'm Dr. Mike Dougherty. I'm the Director of Public Health for Essex County Council. Certainly you will. All the people who have reasons to be susceptible to the flu are also going to be susceptible to COVID. So if your GP has you on the list for flu vaccine, it's very, very likely that you will also be on the list for corona vaccine at that time. So before the 60s are done with the 65 pluses, yes. So the important thing was to make sure that those people who are most likely to get ill or most likely to die if they get coronavirus are done first. So that's the first group that we're looking at the moment, which is the people down to the over 65s and the vulnerable group we just talked about. And that's really very much for health reasons, and that's the view of the Joint Committee for Vaccinations and Immunisations. Once you get beyond that, you get to sort of the policy choices, so the people who are not particularly at risk per se, but they're in industries that we need to keep going, or they're groups who are particularly likely to be in contact with other people. And decisions will be made at that point about how to prioritise them. But you're right, there are groups like teachers, groups like police, shop assistants are a very key group, taxi drivers. Taxi drivers might also be more vulnerable. So there will be decisions made about which of those groups should be done in priority order. But I think that once we get past this very high risk group cohorts at the moment, then we can start to think from a policy perspective about which sort of employees, which group should be done next. The vast majority of people will be able to receive the vaccine without any problems. But if you have any individual sort of serious anaphylaxis issues in the past, then it's probably worth talking to your GP before you get invited for the vaccine. But the vast majority of people will be able to have the vaccine. Been tested hundreds of thousands of times. There's literally 100,000 people were in the initial trials, and then, as you know, 6 million people in this country have had the vaccine since. So it's a very, very safe vaccine. The most common side effect by a long way is pain in the arm. So once you've got it, often after a while, your arm will start to feel painful, your arm will start to feel heavy, but that rolls off after a bit. A number of people are getting headaches as well. A number of people have just felt genuinely unwell for a while, but generally speaking, it's very, very safe vaccine, very few serious side effects. We do not know that, and the sense is they probably do not prevent transmission well. So if you've had the vaccine, you could still pass it to other people. So you need to maintain social distancing. We're not at the moment assuming that this is very good at preventing transmission, just preventing serious illness and illness in the person who gets it. The NHS will contact you either through GP practice or through a central NHS number. It will be clearly from an NHS address. They will not ask you any personal details, and they definitely will not ask you for any money. This is an absolute free service. Everybody will get it for free, everybody, and it will be from an NHS address. So I think that that's the best way of identifying, either through your own GP or something which is definitely nhs.uk. And no, if it's a scam, if they ask for any money or any personal details. Simply around the supply of vaccine, that some areas seem to have picked up more vaccine than other areas, but the government are aware of this. The limiting factor is the vaccine supply, and those areas where they've had a lot of people vaccinated to date, the slowing down the vaccination in those areas so that the other areas can make sure that they catch up and that there is an equitable sharing of vaccines across the country. So in fact, a number of areas in the north did rather better than Essex initially, and the vaccine supply to them has been slowed down so that Essex can get more vaccines and Essex can catch up. So they are, because they don't contain any live vaccine. The problem is people who are immunosuppressed often don't respond well and don't have a good response to the vaccine. So those who are immunosuppressed probably need to talk to the GPs about the vaccine. They certainly need to have it, but it may well be that they produce a less effective immune response than others. But there shouldn't be any harm in them receiving the vaccine because the vaccine doesn't have anything live in it. Generally speaking, you will get the vaccine that's available at the time. If you're not at a big vaccine centre, it's very likely to be the AstraZeneca one because that's much easier to store. Yes, so you would need to, if you have very severe allergies, but it would only be anaphylaxis. Really, I think very severe allergies. You need to talk to your GP about it in the first instance to see if there are any issues that would preclude one or the other vaccine from you. But generally speaking, most people, the vast majority of people will be able to have vaccines even if they've got allergies. You absolutely can. So what it is, it's an injection into the arm, and those people who are on blood thinning medication, they may bleed a little bit more when that injection happens. They may end up with a bigger bruise, a more sore arm, but absolutely they should be able to have the vaccine and should have the vaccine. Any concern, talk to your GP, but the advice is yes, you should still have the vaccine. So the GPs will be arranging for people to be visited in their homes to have the vaccine. It'll be different across the piece, but the NHS are working hard to make that happen as soon as possible. There's no problem at all with that. Yes, you can. You need to have two of the same. The evidence at the moment is very much so. The government are looking at the recent work from Israel that suggested there may have been a lower vaccine response through delaying in the first dose. So after the first dose, there was quite a low response, but that's only early data, and the government need to look at it very, very carefully and understand it better. But the sense at the moment is yes, it is in fact. It is effectively that length of time. It may even be for the AstraZeneca vaccine that it's actually more beneficial to leave it that length of time. Generally speaking, in the longer run. So generally speaking with vaccines, the first dose gives you quite a lot of response and the second one gives you more response and for a longer time. So the sense is if you leave a bigger gap, then you may end up with even more immunity than you would previously, and that may last longer. But that varies somewhat, and that needs to be studied, but that is quite common in vaccines. So generally speaking, you would expect, yes, it is very safe. There's no problem in terms of the longer term in leaving it for a longer gap. It may well be that there may be a slight issue in the shorter term that you may not have quite the level of vaccination you would have had in the short term, but people are advised mainly to sort of to continue to social distance anyway till everyone's been vaccinated. Most of you, if you've got particular issues and concerns, you should talk to your GP. But generally speaking, that the vaccine's safe in most people, and autoimmune issues shouldn't be a reason not to have the vaccine at all. So initially there was more vaccine given to the north and the south, but that's now been evened out, and Essex are now getting vaccine as they need it. The most vulnerable people in Essex at the moment are clearly those who are in care homes, those who are older, and those who've got particular vulnerabilities. And they're the ones that are being vaccinated first. We're also looking at particular high risk groups, working with faith communities, working with those who look after the homeless, with different Black and minority ethnic groups, and to make sure that they can have the right levels of vaccination as well, and are not left behind in this. So there's work going on with NHS colleagues to make sure all groups are identified and have access to the vaccine. The vaccines haven't been licensed for children under 16. Generally speaking, unless they are in particularly clinically extremely vulnerable groups, we would not be giving the vaccine to children. Well, it should be on your records. It should be that if you've had the first dose, that you will be invited to have a second dose. If that doesn't happen, and others around you are, then it may be worth talking to your GP about it. But I'd leave that for a couple of 3 months. But it's very likely you will be invited back. The evidence is that it is very, very protective. So once you've had both your jabs, but once they've been they've had time to take effect and to have impact on you, then first of all, you may well not get the disease at all. And if you do get it, it should be much, much milder. One of the key reasons for doing this is to protect those people who are most vulnerable, who are older, who have conditions like COPD. So it should reduce the risk of serious illness very, very considerably in that group. Absolutely. The other alternative would be to sign on as a temporary resident in the place that you're staying. But certainly, if you can get back, we invite you and come back, then that's absolutely fine to do that. Makes sense. I think if you're offered a vaccine at any particular time, please try and do your best to attend. This is a very, very difficult operation. We need to get as many people done as possible. I would encourage people to attend. If they can't attend, then I'm sure they will be invited again in the future. But it would help everybody if people can attend when they're invited, please. GP in the first instance and get their advice, and then that you would have to presumably let the site know when you're invited, but talk to your GP in the first instance. Generally speaking, would expect it to be infected. It would be very hard to find out whether it would actually be effective or not. Again, some while after the second one, if you talk to your GP, they can look at your antibody response to it, to see if you've actually developed antibodies. But that would be something for you in particular to talk through with your GPs. But it would presumably be through some sort of antibody testing some while after the second dose. The vaccine works in terms of preventing people getting ill, but doesn't stop the infection more widely. So if those people meet up and then meet with somebody else, they could stop the disease from one to another. So 2 people per se wouldn't be a problem, but if those 2 people meet up another person, then the virus might start to spread again. At the moment, while there's lots of people who are vulnerable, while there's lots of coronavirus within the population, while people all haven't had their vaccines yet, it would be inappropriate for that to happen. that's not true at all. There isn't any live vaccine, live virus in the vaccine. It's just spike protein is just a bit of the vaccine that your body can then recognise and mount an immune response to. So no, there's no live vaccine in it. You're not contagious at all when you've had the vaccine.